about Harriet. It's a production meeting.
Oh, we got somebody in the background. We'll work on that here.
Jody Rabbit.
Somehow people are coming in. All right, so hi everybody. We're gonna have everybody mute themselves if they're not already muted. And we'll get this thing going. Thank you for being here. A couple quick Zoom housekeeping notes. You should be muted. If you're not muted, just double check that. This is gonna be probably best in the speaker view so you can see who's speaking. But right now it's kind of fun to go into the gallery view. If you haven't already, you see everybody's faces. It's up in the upper right-hand corner. Sort of a big Brady Bunch vibe going on in here. It's nice to see everybody's face. There's also a chat window if you want to open that up. Later we'll be doing Q&A, and that'll be the place to type in your questions, but also feel free to say hello to each other there where you're calling in from. So we're gonna get this going. My name's Matthew Young. For anyone that doesn't know me, I'm a photographer, I'm a director, I'm based here in Los Angeles. I'm also the founder of Art of Freelance, which is an online workshop, and we're currently in our 10th session right now. But in this current crisis, we've been also trying hard to kind of aggregate useful information for freelancers. And first it was sort of about very short-term financial resources. And now it feels like we're shifting into sort of a medium-term conversation about what this is going to look like for the next several months. A lot of this community are photographers or directors, hair and makeup, actors, lighting assistants, producers. We're people who work on sets. And one of the biggest questions that we've been hearing again and again is when and how we're ever going to be able to work safely with each other on set again, and that's what this call is about. So we've spent the past 2 weeks building out what we think is a pretty comprehensive template for what safety protocols on sets might look like. And we've done it with input from lots of smart people, some of whom you're about to hear from today. We've also asked you to ask a question of us when you registered for the event, and we've read through all of those, and we'll be addressing those as this conversation goes on. So I'm going to show you the blog post and the safety protocols if I'm able to share my screen appropriately. Can you guys see a blog post there? It says safety protocols on socially distanced sets. Is that on your screen? Did that work?
No, not yet.
I'll try again. Oh, because I actually have to click the button that says share. Did that work?
Yes.
Yes.
So this is the blog post that we put together. The people that you're about to hear from on the call sort of helped give input as we went. And it sort of touches on pre-production, and it touches on on-set protocols. We're not going to walk through this one thing at a time. I'll put the link here in the chat bot, but you know, feel free to review this. And we want to make very clear that this is not meant to be the safety protocols. This is meant to be a template for us to all use to sort of start thinking for ourselves about what safety is going to look like personally, to think about what kinds of shoots we want to re-engage with, and are these safety protocols going to be considered, and how many of them, how much of them. There's going to be a lot of information from all of different organizations, OSHA, CDC, WHO, the governor, unions, associations, production companies, and we don't want anyone to think that we're trying to say that this is the right one, but we just want to help this start a conversation about what this can look like. Before we begin this conversation, I want to make 100% clear that we're not encouraging anyone to go back to work before it can be done legally, safely, and with consideration for the greater public health concerns. The reality, and it's been really, at first it was kind of hard for me to just like internalize the fact that like the majority of the work we do is not essential work. Frontline medical workers are doing essential work. There's, you know, the heroes in the grocery stores that are delivering our food that are doing essential work. And a lot of our work, unfortunately, does not fall into that category. And as a community, I think that we just need to be really clear and cognizant about that when we get back to work, we're not endangering public health by going back too soon or unsafely. But that said, we're starting to see clients reaching out, asking about what could this look like. We're starting to see conversations about states reopening. We've heard about Georgia, we've heard about Las Vegas, we've heard about the beaches in San Diego. It feels like there's movement towards that. And so while we're still waiting for, OSHA and the CDC to tell us more ideas for what this can look like, it feels valuable to have this conversation. So we want this to be like a conversation. We want this to be a document. We want this to be something that the community can build on. So we invite you to look at the blog post, read through it, send us your recommendations, your feedback, your ideas, make it your own. We welcome everyone to use this as they see fit. We really want our community, photographers, hair, makeup, lighting assistants, producers, we want everyone to feel empowered when they do go back on set to be able to, look and see and know what is more safe and what is less safe in this sort of new environment. So please, I invite you guys to help continue this conversation even after this goes on. But without further ado, we have three special guests, panelists here with us today. I'm going to introduce Dr. Davenport first. We're going to have a brief conversation, and then I'm going to introduce Carrie Heather and Betsy Davison as well, so that the four of us can continue to talk, and then we're going to leave time at the end for Q&A. So Dr. Davenport is a specialist in infectious disease. He's practiced for over 20 years. He's currently the medical director of the Ascension Borges Medical Center Infection Prevention Program. He's also serving as a medical director for their Wound and Hyperbaric Center. Basically, he's much smarter than all of us put together when it comes to these medical issues, and we really appreciate him taking the time to have this conversation with us. For context, we spoke about 6 days ago and sort of got his input and feedback on this blog post, and now we're excited to continue this conversation with him and get into some of the nuance with it. So Dr. Davenport, thank you for being here. I'm gonna pin your video, so you should be big for everybody there so they can see you. So I wanted to start with asking you about some of the milestones that we might see in the next year or 2 years that might change this conversation drastically. In the news, we hear a lot about rapid testing, we hear a lot about immunity testing, and we hear a lot about a vaccine. And we think this conversation is going to be about the time between now and then, but would you just briefly sort of talk about milestones that might change this dramatically?
Unfortunately, I don't think there's going to be a lot of big milestones coming out in the near future. The main thing we're all fairly certain about is it'll take about 12 to 18 months to have a vaccine out. And that's going to be the first big game changer. Until then, what we're looking for is to ramp up testing of people for acute disease, and then testing of people whether they have antibodies to the disease. But testing of the antibodies and ramping up the testing won't change a whole lot of things. We'll have a better idea of the risk. But you've probably seen in the news a lot, there's all kinds of different models that make different predictions. And the reason they're all different is because there's so many pieces of the information that are missing that we'll get with the testing. But I doubt that we'll have a sequential set of milestones that will slowly open things back up.
So can you talk a little bit more about testing and what we might see in the near future? I mean, just yesterday, the New York Times had a report about antibody testing and these new tests not giving a lot of false positives and not necessarily being totally accurate. Do you envision a world in which we can be tested rapidly before we engage in film and TV production?
Well, we have a test that's generally fairly useful for diagnosing when you're infected, when you have acute disease, and you may or may not have symptoms, and that's called a PCR test. And that would be useful. And when they develop a point of care test that's easily able to do on a set, for example, if you had this, you could test everyone, a few hours before the shoot or a day before the shoot and have a reasonable reliability that no one would be infected. And that's something that's already here, and it'll become more accessible with time, and particularly the point of care point of it. The antibody test or the serology test is not going to be useful for a long time because it really doesn't yet determine whether you're immune or not. We don't really have the information to say that if you have antibodies that you're immune to the disease and you can't get it. And that'll take some time to determine that. We'll have to, with humans. The antibody tests are useful for researchers to get an idea of how many people have been infected, but it's not really going to help in terms of practicality. There was some mention in the lay press about having antibody passports. If you had a passport showing that you had antibodies to the disease, that would mean you're immune and you can go back to work and you wouldn't need to worry about it. Well, unfortunately, we're nowhere near there yet. So we're still left with just having a test that'll be able to tell people that have recently been infected.
Got it. So if we're looking at a 12 to 18 month timeline for big systemic changes in the world the new normal that we're finding ourselves in, and the premise of the call is that we want to get back to work. I guess my question for you is, from a medical perspective, are we crazy to be having this conversation? And sort of, yeah, I guess just that. Is it okay to have this conversation?
I don't think we're really crazy to have it. I think it's really time for everyone to start thinking about it, because people need to learn something about safety and something about protecting themselves. And then they need to realize that the new normal will be a normal that involves increased risk as compared to what they were used to. So they really need to learn something about that. And as you've seen, we can't really keep complete lockdown of the businesses and the economy forever, because there's a significant collateral damage. Social isolation and lockdowns of businesses is a very blunt instrument, but it's an instrument that's very effective. What we'll need to do going forward is finding some more nuanced tools and more individualized risk assessments and ways to evaluate risk. So I think all businesses, not necessarily your business, but at some point your business will go back to productions and shoots, and you'll need to do that in a slightly different way, and you'll try to minimize or mitigate the risk.
Yeah. So the basic premise of our previous conversation of the document that we put together is essentially that there is a spectrum of risk that people are going to face. Right. We had the conversation that an outdoor shoot is safer than an indoor shoot. Maybe I should reverse that. Indoor shoot is riskier than an outdoor shoot. A shoot in the Bronx is riskier than a shoot in Wyoming. A 30-person shoot is riskier than a 3-person shoot, but there's nuance to all of that. And not necessarily any of those things need to be true. So can you talk more about risk assessment and how that could apply to our shoots?
Yeah, I mean, what we do in the hospital is, for significant things, we do an individualized risk assessment. If you're going to do a procedure or something, you look at the size of the room, the ventilation, how many air exchanges it has. Then you look at how many people are in the room, and then you try to minimize the number of people in the room that would be exposed. Then you look at whether everyone has the correct personal protective equipment. If you're out of, mask and gloves and stuff, that makes things a lot more difficult. So we look at all that and try to assess it on an individual basis. And those same safety principles can be applied to any industry, including what you do. And you can look at a shoot in a large room versus a small room. The more complex the shoot, the higher the risk, because there's more things that can go wrong. The more people that are there, the greater the risk. Ventilation is important. So there's a lot of things like that. But I think the take-home message is, with appropriate training and thought, you can do a safe shoot in a risky area like the Bronx, and you could do an unsafe shoot in an area that you think is of low risk, which would be some rural part of the United States. So those are kind of the basic principles. You can kind of look at all those, and we can go through them if you like. So
yeah, and you gave us a really nice sort of framework for assessing risk for our industry particularly, and that's number one on our pre-production protocols that we posted on that blog post, and the things that you mentioned, to sort of ask ourselves before we even start thinking about a shoot, is there, what is the risk spectrum? Where does it fall on that risk spectrum? So I'd encourage people to look at that. And then, you know, my question also is, can this risk assessment start to inform the creative of the shoots, the kinds of shoots we're being asked to do? Can people plan safer shoots from the very get-go versus try to take a shoot and fit it into a safe box, which is a question for the people that hire us as we keep going. So you also mentioned, do you think that risk assessment is only something that should be done sort of by the people in charge, the production or the clients or the photographer, or do you think that risk assessment is something that each individual person can do for themselves, and then to sort of, as collectively, you've talked about social awareness in our last call being an important tool for people to use on set. Would you talk more about that?
yeah, well, I think everyone needs to take some responsibility for the safety on the set. It's very important, and unfortunately, if you deal with safety issues, you learn quite quickly that you can't rely on other people to always be there for you. So you need to start thinking about that. You would hope in a large complex production or something like that, that they would be able to hire a full-time safety monitor, someone whose sole job is to look at the safety of shoots and what needs to be done, and is always out there looking for you. But that's not always going to be the case. So what we talk about in the hospital and other things, we talk about getting reliability above 100%. And the way we do that is really with two people. You know, if you're giving a blood transfusion or something, you have two people and they call out the numbers and they check all the papers and all that. And that's a way you can get more to 200% reliability. If you have someone that's watching, you're less likely to be able to make a mistake. And also, you kind of, everyone looks out for each other. So you're looking out for yourself and looking out for the others, and you increase the reliability. So there, and the things we're usually thinking about are straightforward in terms of the distance of 6 foot or greater, and washing your hands for 20 seconds, wearing gloves if you're passing equipment around, those kind of things. And other people can look at ventilation and how big the room is. So there's a lot of things. You could read a little bit about it, and once you become aware of that, you'll develop what we usually refer to as situational awareness. This will become kind of like second nature or intuition. You'll go into a setting or a set and look at things, and if you observe things carefully, you'll be able to come to assessment whether you think it's high risk or medium risk or low risk.
Yeah, great. Well, that was the context that I was hoping to sort of start with, the timeline that we're talking about between here and when testing or a vaccine, you know, really changes the game, about the fact that there's a spectrum of risk from very risky to less risky, and the fact that we should have both someone in charge of safety, a sort of health and safety officer on a set, but that also it's each individual person's role and responsibility to have information, to arm themselves with that, and to approach the shoot with some awareness, some situational awareness, like you said. I see the questions that are coming into the chat window. I'm going to save those towards the end when we get into the Q&A. Right now, I'm going to introduce Betsy Davison and Carrie Heather. Betsy is the co-founder of Space for Arts. They are an online platform for photo studios, production studios all around the world. And she's really committed to the community of production. And she's been a big supporter of Art of Freelance and our showcases, and she's hosted lots of amazing talks in New York and LA for the community, and we appreciate her being a part of this. She also introduced us to Dr. Davenport, so thank you again, Betsy, for that.
It's a family member, so I promise I'll be nice, David.
And Carrie Heather is the Director of Production for Creative Blood Agency. They're a large photo and film production company based in Los Angeles and London. We originally were planning to connect about sustainability on set. Creative Blood has been a great industry leader in that. And then obviously coronavirus changed that conversation, but we sort of shifted our conversation about sustainability on set to safety on set. And Carrie's been doing a great job of reaching out to their vendors and talking to other producers about what people are preparing to do to get back to work on set. So thank you, Carrie, for being here also. Do we have to unmute Carrie? Hi. Oh, great.
No, I'm here. Hi.
So quickly, Betsy, just to ask you, you're in touch with a lot of studio owners around the world. What kinds of questions are you getting from studio owners? What's the take from the studios?
First and foremost, when can they open their doors? Sanitizing the set, basically. Like, how do I guarantee when the production company or the photographer or the clients come in, how do I keep them safe? What we're finding is that as clients are reaching out to production companies, essentially they're saying, I have no idea how to do this, you figure it out. Which led me to reach out to you and to David and to say, I think we need some help here to make a sound recommendation based on medical advice. Not that we're going to be, this is the sole expertise, but the production studios out there are nervous about safety. They're nervous about the length of the shoot and how many people can be in that studio at any one time. And if the crews go back, can I technically provide, remote to the art director? So the technology that needs to be in place. So basically a lot of the questions that all of us are asking. The thing that's important, and thank you, Matthew, for the road forward, but for us, it's really important to have this conversation. I know this is going to be a living, working document, and like you have said, we would love data and feedback. As any scientist knows, you make all the mistakes in the world and then you become the expert because you've made every mistake that there is. And I think David can speak to that. And so one of the things is having this conversation, but we would love for this to be a portal so that people can give us feedback on what works and what doesn't work. Because to David's point, it's a little nerve-wracking to think that we're going to all be back there in the new normal and there isn't going to be any protection. There's no magic bullet that's going to protect us. But if we all come together, we are an uber competitive industry, right? As far as I'm concerned, there is no competition when it comes to safety. None, zero. Our industry needs to come together on this one because there's going to be, as to Carrie said, oh, I'm the best sandwich. There's going to be lots of ideas out there, but I think getting sound advice and medically based advice is going to lower our anxiety level a little bit. So cool. I've said a lot of things in a little piece. I'll pass the baton to Carrie because I'm sure she's got a lot of stuff to say about production. But thank you.
Carrie, thank you for being here and thanks for helping facilitate this conversation and bring us all together. We really appreciate your support of the community in general. Carrie, what are producers doing to prepare? Is it does it feel especially stressful? Because I feel like a lot of this is going to fall on the shoulders of production to have answers before we get together on set. How are you thinking about all this?
Hi, everybody. Yes, I'm thinking a lot about it. First, but before I get started, I just want to put the sandwich context into place, what Betsy mentioned. So let me just put that into context because there were only 4 people on when we said that. So what I'm saying is we're going to start to see, if we haven't already seen, a lot of best practices come out, right? I'm sure all of your inboxes are getting hit with, this is the best, and this is the list, and this is what you should do, and here. And so what I'm saying is a lot of them are credible, and there's common sense practices that we can all take from it. But what I'm saying is that there's no one person who's like, I'm the best sandwich. We've got the best sandwich in town. And it's like, at some point there might be a best practices, but as Betsy said, as Matthew said, this is a living, breathing document. And we are going to learn so much as we go, where a few weeks ago, which feels like a few months ago, no one was wearing masks. And now the CDC has recommended covering your face. And so in production, where a lot of the liability falls onto us, where we have to take care of a lot of things that come up during the shoot, before the shoot. And I think one thing I want to say is that there's going to be a responsibility that falls back on each and every one of us, and for each and every one of our teams, because at this point, unless I have a sanitizing station on set, are you going to take a mask from me if I hand it to you right now? Some may say yes, some may say no. And so a lot of us we really should be stocking up on our own PPE kits. And I'll let Dr. Davenport sort of take the reins on saying what is, useful, what is superfluous, but really our teams, whether we're gloved, whether we're masked, we need to be doing it for ourselves. Please don't be relying on production to just be handing you a mask on set. Especially for our hair and makeup teams and our wardrobe teams, the people that have the most close contact. I've been in touch with a few agents who are talking about their artists really ramping up their kits, face shields. Unfortunately for the sustainability world, they're talking a lot about disposables. So like a one and done. I don't know if there's a way around that at the moment. I've seen these, we talked about this a little bit, of germicidal wands, like UVC wands that are, going to kill bacteria. But as Dr. Davenport pointed out earlier, whatever is in the crevices is not really going to get it. So unless you're like literally spinning your keys like a rotisserie chicken, the underside isn't necessarily going to get clean. If we put masks in maybe, and we're pulling out the folds, maybe not everything's going to get clean. So unfortunately, I think disposables are going to be the way we go. That's just one place. And there are many. We're all pillars that hold up production, from the creative side to the production side, glam, catering. And what we're going to be waiting for, and Matthew, just stop me if you need me and you want me to, if you had a question, or I can kind of keep going on basically some of the research I've been doing and what our plans are, what we hope to see happening in production.
Well, so I think that it's a great point that, and it goes into this idea that we need to take personal responsibility. There can be both risk assessment and safety monitoring, and that the people in charge, and I obviously put that in quotes, can do a lot of work to make safe sets, but also we as individuals need to take a lot of responsibility to make sets safe. And we will have another conversation about sustainability and how all of that plays into this. We'll just wait for a later date to continue to do that, unfortunately. But you bring up the great point about personal protective equipment. I think a lot of people have those questions. So maybe Dr. Davenport, you could speak a little bit to personal protective equipment for crews. People have questions about, do I need an N95 mask? Does a surgical mask provide some other protection? Should I be wearing latex gloves? Sanitization, is hand sanitizer okay? Do I have to wash my hands with hot water? Can you speak a little bit about personal protective equipment and what crews should be prepared with?
Yeah, the most important things is a mask and gloves. You probably won't be able to get an N95 mask until they ramp up production. But standard masks provide some protection. Primarily, they keep you from transmitting the disease to someone else. So if everyone has a mask on, the chance of anyone transmitting the disease to someone else goes down significantly. Gloves are very important. If you can do it sometimes, if you don't have the N95 mask, if you can wear a plastic face shield, that will protect your face, which is the area where most people become infected through their nose or their mouth. That would be useful. And then something to clean your hands when you're not close to a sink. And any alcohol-based sanitizer that has 60 or 70% alcohol will actually do the trick. In terms of washing your hands, you don't have to have the alcohol. If you wash your hands for about 20 seconds, And if you sing happy birthday twice, that'll be about 20 seconds. That'll do. The virus has a lipid envelope, and the only reason that's important, it's very easy to kill. So household cleaners and most detergents will clean it. There is a website from the Center for Disease Control on household cleaning and disinfection, and almost everything there would directly apply to what you do in your line of work. For high-tech equipment, they have specifics. Often people use alcohol sprays or alcohol wipes. Some people use plastic covers over equipment. And, you know, the more you want to limit the number of people that use the same equipment or passing things around, and that's where the gloves would come into play. But most of those things are fairly straightforward, and they're easily obtainable.
Right.
Matthew, oh, sorry.
Yeah, no, go for it.
I just wanted to follow up. There is a theme developing in the questioning, and that is liability. And us thinking about, okay, we're healthy now. We can find out whether we actively have COVID before we walk on set or the day before set. But what, you know, how do we as an industry, maybe there's not an answer today, how do we deal with the liability of this shoot, the waivers that people have to sign, and then ultimately we're going to put our toe back into shooting either on location or in a studio, and we're going to find out that people are getting sick after the shoot. Can you just speak to the anxiety level? I think everyone is thinking about that. And the other thing they're thinking about, and the second part to my question is, okay, maybe we have an antibody if we've already had it, but chances are we might be able to get sick again. If I didn't die the first time, am I going to die the second time? So if you could sort of, as an overarching question, but thank you.
Is that a question for me or for?
Yes, it's for David, yes.
I'm not sure exactly what you asked, to be honest, but
the liability of being on set and
liability. I'm not really an expert in liability. From a safety point of view, you want to make safety everyone's business, and you know, that's the best way to think about it. Who's responsible? That's something for attorneys, and I'm not an attorney. There is a way beyond safety monitors, which are great. If you don't have that or don't have the luxury of that, you can develop a buddy system where someone watches what you do and the other person watches what you do. In the hospital, when we go into a room with a COVID-19 patient, there's all this putting on the gowns and everything. And the way we make that safe, like I was talking about previously, is someone watches what you do. And if you make a mistake on how you put on your glove or something's exposed, they tell you. So that's a way to increase the safety on the set without having a safety monitor, having a buddy system. Or if we didn't want to have a closed set because we're limiting the number of people, you'd have your partner or somebody come in to watch you or to call you out. Those are things. In terms of getting sick twice, we're not sure of that. There's some early small amount of data from China that you may be able to get this twice, but we really don't know. But the big thing we don't know is how long, if you have immunity, how long it will last. What we do know for most viral infections is that as these epidemics or pandemics happen, more and more people become immune and more resistant to the illness. So in general, most of the time, the disease becomes milder and milder. But that's what usually happens, but we don't know that for certain with coronavirus.
Got it. Dr. Davenport, another question that comes up a lot is, I think we're wondering who we should be looking to for these kinds of protocols. And CDC has some out, we're waiting for OSHA, we'll get them from our friends, from our producers, from our unions. Do you have any perspective on, is there a hierarchy to the kinds of advice that we should be taking for this? Is it?
Well, I can tell you generally in the United States, almost all the guidelines are some version of the Center for Disease Control guidelines. And those are on the internet and they're easily searchable. So the CDC usually has most things. And there are hundreds of other ones, but they're all just slight modifications of the CDC guideline. For the world, they use the World Health Organization. and they have recommendations that are sometimes slightly different from ours, but if you read most of them, they're all fairly similar. So if you wanted an easy access website where you could go to and get lots of information, probably be the CDC. OSHA, or the Occupational Health and Safety Administration, they're mainly there to kind of try to enforce the recommendations of the CDC. And they have a very small staff. So they usually end up not often really enforcing things, but they respond to complaints. When someone has a complaint of unsafe practices, someone would call and say, I think what they were doing was very unsafe. They were doing this and that. Then they'll send out a team and investigate that. That's what usually happens.
Got it.
Does that help?
It does. Another quick question, and then Carrie, if you have another question for the doctor. But Dr. Davenport, I was actually really taken and surprised by how much you spoke about ventilation on our first call, and it was something that I hadn't heard a lot about and didn't expect, and feel like it applies a lot to our sort of risk assessment on these shoots. Will you speak more to how ventilation in a studio on a location can make a shoot more risky or less risky?
Well, it's an airborne virus, so you usually acquire this via the airborne route, primarily through your nose or mouth. And the virus is diluted in the air once it comes out. So the larger the room, the more chance the virus will be diluted. And then in the hospital, one of the ways we minimize risk is we have like 12 air exchanges per hour in these rooms, and they have high efficiency particulate air filters, HEPA filters, and things like that. And that really helps keep the air clean. When you don't have that, what you can do, if you're shooting outdoors, the virus is kind of immediately diluted beyond 3 feet. If you have fans, you can use fans and have a general direction of the air movement on a set, and that can often help, particularly if you can get the air movement to go outside, through a window or something. And then, there's other basic things you can disrupt the airflow. If you have major issues you can't fix, you can use plastic shields. And that's why when you go in some hospitals now, these people are sitting behind these little plexiglass shields. It's basically so to try to disrupt the airflow. So it is important to think of all those things. And then when you get really close, you can't disrupt it. So does that make sense?
Sure does. Carrie, do you have another question for Dr. Davenport?
Yeah, I just, there's something that's, I was wondering if you had a thought about models and them being on set. I'm thinking about some of the ways that we can mitigate being close to each other. One of the ways that's really hard is if we're shooting more than one person who isn't necessarily living together, quarantining together. Mostly everybody can step back, but if we do run into a situation where we are shooting more than one person, is there something you would say that we should do? Keep them masked right up until they're shooting, have them obviously other than just facing away. What would your thoughts be other than the obvious, don't shoot two people together?
Right. Well, you should minimize the length of the exposure. If there's a risk, one of the things you can do to minimize the risk is minimize the time. So they could, I don't know, practice or run through, or I don't know your specialty, but blocking all that could be done with mask on and the stuff. And then for the actual shoot, they could take the mask off. It's probably for those people that are going to be kind of in very close contact. Ideally, it'd be great for them to be able to be tested, before the shoot. And then that would give people a higher degree of comfort in doing that. But there's a risk of being close to anyone, and that's for all of us. In this case, it would be on the job, but all of us that come within closer than 6 feet of other people,
right.
Risk.
And you talked about the POC test, the point of contact test. Is that something that you really see kind of being available to the masses in the next 3 to 6 months?
I'm not really sure. I mean, I guess we started off talking about milestones. If we got to that if we did have that would be a milestone. What you're seeing now with the antibody test, not to change the subject, is the Food and Drug Administration made it a lot easier for anyone to put an antibody test out on the market. and they put so many out on the market, there's no real quality control. They usually go through a lot of safeguards. So what I'm hoping is that they don't use this point of care test for actually having the disease or not. I hope they don't change what the regulations are, because you want those to be reliable. But I don't know how long that'll take. We're still having an enormous amount of trouble getting enough testing for medical reasons and for public health reasons. So probably not soon.
Dr. Davenport, pulling a question from the chat bot window, which I think sort of touches on a lot of these bigger picture things. So if we're going to have a safety monitor, you know, we're all going to do our best to train ourselves to assess our own personal risk and the risk we're putting in other people and assess the risk for our shoots. If we do have the opportunity to have a safety monitor on a set, is that someone that needs to be medically trained? Is this all common sense stuff? Is there a training that somebody would go through to sort of qualify as a health and safety monitor for a production?
Don't necessarily have to have a medical background, I don't think. It would be good to talk to someone that does infection prevention, and all hospitals have an infection prevention or infection control office, and they have some basic recommendations. The other place you could find some of the basic things are right on the CDC website, but a lot of it's what we've been talking about: hand washing, personal protective equipment, masks, gloves, all those things. So you really don't have to have a sophisticated medical knowledge. You're just looking for basic safety things. So I don't think it's that hard if you spend a little bit of time looking at it. But to have someone to bounce questions off of, if you could go to an infection control or infection prevention office of any hospital or small medical center, they could probably put you in touch with someone that could talk to you about it.
Right, but it's more about that situational awareness and monitoring than it is about a deep medical knowledge. It's knowing when somebody sneezes and doesn't go wash their hands immediately and touches some gear, and calling out that behavior, or identifying that behavior, or seeing unsafe things in the catering or the craft service and calling that out.
Exactly. They're very, very straightforward. You know, a lot of it's what your mother would tell you if she was worried about coronavirus and she was reading about it, about washing your hands, not sharing utensils. It is pretty straightforward, but you need to just think about it when you're, you know, on the set, so to speak. And that's why sometimes it's good to have a second set of eyes, because if you're focusing on what your primary job is, which isn't safety, sometimes it's hard to do both at the same time.
We do get in the heat of the moment. So about half the questions in the chat bot are about masks. And so I wonder if you could answer two quick questions around masks. One is sort of, I guess the question is, can you rank the mask's most effectiveness? Someone mentioned a P100 versus an N95. But I think a bigger question right now is ethically, should we be trying to get masks that are needed by frontline medical workers right now, or should we not be doing shoots that need to have N95 masks until they become more readily available?
Probably shouldn't be trying to obtain an N95 mask right now, because there's a shortage in too many areas of the country. The next best thing that's fairly close, you know, is just having a good hospital grade mask, a surgical mask, and a face shield. The face shield deflects the flow of air around you, and the mask will help protect you as well to a limited degree. So I think that's reasonable in most cases where people are all healthy. You know, the thing I guess we haven't said, but the most important thing is for no one to come to work sick when they don't feel good. And that may be problematic for other reasons, but if anyone feels sick or has a runny nose, cough, something, they really shouldn't show up. And that's one of the hardest things for people, because they need to work.
And you mentioned in our first conversation the idea of having somebody call the crew the night before to check to see if they have any symptoms, to take temperatures when people get to set. But we also know that there's a good number of people that are asymptomatic that could infect other people. And so that's not a silver bullet either. But obviously, if somebody has a runny nose, that could be a symptom of coronavirus, or it could be a symptom of something else, but they still probably shouldn't come to a set. And then it opens up a big question that we're going to need to face, which is, does that person get paid for doing the responsible thing and not showing up to set? How do we have backups for people or understudies or some way to sort of fill in for those crew members that do the responsible thing and don't come? And how as an industry do we face that sort of conundrum there?
Right, right. And then in the hospital, you might, if you have the ability to have a closed set, when they show up at the set, someone could have them fill out a questionnaire. It's basically whether they have a number of symptoms, and they could scan their forehead to take their temperature. That's what we do in airports and hospitals when you want to get in the hospital these days. So there's things like that you can do. But one of the least expensive, effective ways is to call them the day before and then check with them before they start working, if you can.
Yeah. Well, I want to open this up to questions in the chat bot. We'll continue to try to ping those off of Dr. Davenport, Betsy, and Carrie. So if you have any questions, please feel free to put them in. Carrie, Betsy, if there's anything else that's top of mind for you, feel free to jump in. See, Betsy, I see you talking, but you're, oops, yeah, you're muted. There you go.
Matthew, you had an interest, when we were talking with David, you had an interesting thought, and that was shorter shoots and longer days. You know, be patient. Maybe there's a studio with an outdoor space where you stage the talent. Somebody has a roof, or somebody has, you know, an associated space. But it was an interesting thought. I know, David, you reacted well to that, meaning we're all going to have to be patient, but maybe it's shorter time on set and it's 3 days instead of 1 day.
Right.
Yeah.
Maybe you could set up and practice outside and then go inside if it's an inside shoot. You could have your meetings and talk and limit people and, you know, go through things and then go inside. That's one thing. And then when we limit the number of people for what we do in the hospital, we have more rolling shifts. You don't have people coming in at different times. So just, they're all doing their job, but they're not doing it all at once at the same time in the same place.
And is that because it's both, you're less likely to get infected at all in that shorter time, but also can you speak to the viral load and that some people, you can get a worse infection if you're around somebody that is infected for a longer time?
Right. The length of exposure is a risk factor. So the longer you're exposed, the higher the risk. And then the amount of potential something contagious, viral load, if you like, you're exposed to, the higher the load, the higher the risk as well. So one of the things is decrease the number of people that could transmit the virus, and then decrease the duration of time that any one person's exposed to someone that may be infectious.
So this question that just came up into the chat bot is something that's maybe a good question for Carrie or Betsy to touch on also, but that we have a world in which we're going to have potentially longer shoots that are slower so that they're safer, that have much more consideration for safety guidelines, and that's going to have budget implications and ramifications. And so how do we think about the fact that some shoots are going to have less ability to put in place all of these safety protocols? I mean, clients are saving some money on not traveling and having some pieces be virtual, something we haven't talked a lot about, but something that, you know, obviously people are exploring, and that there's a lot of things that can be done virtually now, and that's exciting and limits the number of people on set. But how do we go about thinking about budgets and schedules and timelines?
I'm happy to take that one. Let's see. Unless you want to speak first.
No, you go.
Okay. So I think there's going to be across the board a slowdown that is going to happen. No matter how much money you have or don't have on a budget, we are going to have to, essentially the onus of this will fall on the client in the end, even whether production is released from liability. And we talked a little bit about insurance and liability, and that is a huge conversation that I think will develop as more insurance policies renew and we see exclusions there. But in terms of having to put things in place, safety has to come first. And I think no matter how this disease is contracted, and it will be hard to prove, the marring of a reputation that you got sick on a enter in the name of whatever shoot you're working on is gonna, will carry through. And so it has to be the number one priority, no matter what it means. If it's a smaller shoot, then perhaps it's not a sanitary ambassador that is walking around with a team that is working on a shoot. Perhaps it's 2 people, but there will have to be something in place.
Yep.
I'm not sure if that answered the question completely.
No, I think that, well, I don't think that there is a complete answer.
Yeah, and it's
because
ever evolving. I mean, these are
Right.
extraordinary times, right? So
Can
Exactly.
I ask a follow-up?
Yeah, of course. Yep.
That is, would there be a way for us to standardize what that looks like from a price point of view, so that people aren't, it's 29 cents over here and it's $4,000 over there? If we all come together and we're giving good feedback, is there a way for us so that all of our clients understand, oh, that's the safety awareness person and that should cost 29 cents an hour, or whatever that is? Would there be a way for us to do that?
I do think that there's going to be new line items on budgets that will become standard, and that we need to understand what those new pricing is for those things. But I think that the bigger point for me is that, like, how can this just start to inform the shoots from the very inception of the shoot, where we're thinking about shoots that can happen in safer environments. We're thinking about shoots that are scheduled in a more safe way. We're thinking about shoots that provide the appropriate budget to do these shoots, and that we all have the sort of situational awareness, to Dr. Davenport's point, that we can call out an unsafe budget or an unsafe timeline or unsafe creative from the very get-go and say, I'm sorry, this sounds like you want to get 30 people packed into a small room for 12 hours without the appropriate budget considerations. We need to have a conversation about what it is that you're looking to do. But I take the point that producers and reps and photographers could start to think about standardizing sanitization, disinfecting, health and safety officers, all of those things, but some budgets just won't qualify for those. And I guess the other point, and Dr. Davenport, maybe if you have something else to add to this, but that, like, there can be a health and that we should all be the health and safety officer on every set. Even if there's someone that's official, we should all be empowered to be able to point out unsafe behavior. Is that how it is in a hospital? Is it, I mean, can anyone raise a red flag? Is there anonymous feedback?
From a safety point of view, we always talk about leveling the playing field. And we initially had a lot of pushback from doctors that were used to being kind of at the top of the food chain. But to have a safe hospital, you need to have everyone from the nurse's aide, from who's ever cleaning the room, to be able to call out someone or ask them whether what they were doing was entirely safe. And it was only when you got everyone on a level playing field that the safety went up considerably. So it is important. And it's, like we said, you don't have to have a great amount of training to learn some of the basic principles. So I think it should be doable.
Yeah. Betsy, something else that you mentioned on our first call, which I thought was really valuable, was, and it is to this point, is the idea of feedback, and how do we create these feedback loops, and how do we create, can myself as a photographer, can producers I work with, can my agents, can we have anonymous I mean, it's easy on Google Forms to create an anonymous feedback form. Can we start taking feedback from each other, and as crews, can we feel empowered to speak up and say, hey, I didn't love the way that there was only one bottle of hand sanitizer by Crafty that everyone was using together.
And that especially is important as it relates to people shooting in a space. Like, I didn't feel that there was enough ventilation in that space, or, the list could go on. But David, could you speak to the emphasis on data collection? As a scientist, I know.
Oh, it's really important. And I think what you need to be prepared for, as difficult as it may sound, is you need to put your foot in the water and start taking baby steps. And there'll be a lot of mistakes along the way. And the important thing is that we learn from mistakes. And we've done that in the hospital. It may sound scary, but when this all came out, we felt like we were building the airplane that we were flying in, and every day we go over some bumps and we learn some things. And, it just took days and days of meetings and talking about things. And basically people got better and better at doing what they needed to do. But I think it's a pipe dream to think you will go into this with all the answers. You will start it and try to minimize the risk. And every day you're going to learn something. And I guess the good news is you'll go home and say, well, that wasn't great, but I know how to do it better now. And I think that's the important thing.
Well, if there's any last questions, it's almost 1 o'clock here. We really appreciate everyone taking the time to join for this call. We especially appreciate Dr. Davenport, Betsy, Carrie, you guys taking the time to have these pre-calls to help give your input on these protocols on this blog. Like we said to everybody at the beginning of the call, we want this to be the beginning of the conversation. We know that unions and AICP and production companies are working on protocols, but we're afraid that we might start getting called back before we know exactly what we're doing. And exactly to your point, Dr. Davenport, that we're gonna have to dip our toes in the water and figure out how to protect each other as a community and stay aware on top of this. I'm going to stick around for a few minutes to see if there's any other questions that want to be answered. I invite anybody else to stick around that wants to, but I just want to once again say thank you to everybody for being part of this call. Please, as a community, read the blog, check it out, give your input. Like, we want this to be a community document. So, you know, if anybody else has thoughts about this, there's been amazing things in the chat bot here, and we appreciate everybody's thoughts about this.
Yeah. David, can you stick around for a few more minutes? I know.
Sure.
Minutes, but, okay.
So it sounds like we've got another few minutes with the doctor here. Oh, and Juliet Wolf said the APA is continuing this type of conversation tomorrow in the chat bot. That's great. We appreciate that. So until I see another question on the chat bot, I'll just ask you, Dr. Davenport, about sort of equipment and disinfecting. I mean, we're just talking about the normal stuff, Lysol and bleach products and using wipes, using paper towels. I mean, can you speak to actual disinfecting of equipment? That seems to be one of the big questions that people keep asking.
Yeah, the first thing is that if the equipment is soiled, you need to clean the equipment first, because cleaning and disinfecting are two different things, and people don't always make that distinction. So if they're visibly soiled, you need to clean them with however you clean them. Then disinfection is, you know, the two most common things are dilute bleach. You know, I think it's a 1 to 10 solution, but that's sometimes corrosive for a lot of equipment. And the other thing that will kill the virus quickly is alcohol, 60 to 70% or greater. And there's lots of products out there, and most household products will kill this virus. So it's not really that hard. It's important to, if you have sensitive equipment on cameras and whatever else, you might want to read what the recommendations are for cleaning them. And probably some of their standard recommendations would also work for cleaning. If you want to know for certain, there's an FDA website about detergents and stuff like that. I will send you an attachment to a link about cleaning stuff from the CDC that has a lot of that you can share with your group.
Just to follow up on that, David, how often during the shoot should people be, I mean, obviously everybody's going to try to not multiple hands on multiple pieces of equipment, but how often during a shoot should we be doing that cleaning?
It's a good question, because I haven't seen that written down anywhere, but you know, as much as you can reasonably, you know, and it's hard to say, you know, it depends on how long it is, but if there's a lot of people handling something, it's best to have gloves, and ideally if you can do it like once an hour or once every 2 hours, but it kind of depends on what kind of equipment and how it's being handled. You know, if it's set up, it's not a big issue. I think in general, if you're working and whenever there's a normal break, a break when you would go to the bathroom or something, but that would be just anytime there's a break and you have time and you don't have anything else to do, it's be a good time just to wash your hands. It's a simple, safe thing. So
More is better.
Can I ask a question, Dr. Davenport?
sure.
So something that often comes up in photo shoots is we will use motorhomes as our bathrooms. And we're finding, at least I know in the research I'm doing, is that, we, instead of just having one motorhome and we have one bathroom, we know we're going to be probably needing to get multiple bathrooms, whether that's in the way of porta potties or like nicer ones, or some motorhomes have bathrooms that are off the backs. If I'm waiting online to get into a bathroom that someone else is using on a shoot, I'm maybe pulling the door with a key or something, or a gloved hand. How long should I wait to go into the bathroom reasonably for the droplets to disintegrate or to go hit the floor before I walk in?
Hard question. Most people that aren't infected, it wouldn't be really a big issue. If they were clearly infected, it could take 30 minutes to an hour to get all those particles out of the air. I don't think that's going to be the main mode of transmission in bathrooms. It'll be mainly by direct contact with surfaces. So probably the best thing you can do is when you go in is if you can take some Clorox wipes or something like that. And when you go in, you use a Clorox wipe to open the door if you can, and then you go in and you use a Clorox wipe on the seat and the handles of the sink, what we call high touch areas, the sink. And those are probably the more important things to do. So the amount of time, unlike a hospital, isn't a big issue, but actually wiping down the high touch surfaces.
Got it. Another question that's come up a fair bit is sort of eating on set, catering. If it's safe for, traditionally we'd have these buffets set up for everybody to eat from, and it's crazy to think that that was the world we were all digging our hands into the same batch of M&Ms all day, and obviously that's not going to be okay. How much should we stress out, have anxiety about catering? Should we be doing single served, prepackaged individual meals, one person to hand out the food? Do you have any thoughts or advice about catering, about eating on set?
All I can tell you is that in general, we moved away from having group food where you serve yourself or pick up your own rolls and all that. So ideally, if someone serves for you, that's fine. But usually single serve and disposable silverware and all those kind of things are better. When you look at it from a safety point of view, is there a way to have large amounts of food and do it safely? Yeah, if you have someone that serves it and there's a plastic shield in front of the food and all that. But often just for simplicity, people are going to little boxes of pre-prepared food that you just pick up because it's just a lot easier.
Great. One more big question that we didn't get a chance to touch on, but are there groups of people that you would recommend not be going back on set as we take these baby steps towards production, and there are still higher risk sets?
Yeah, there are people that are higher risk for having serious disease if they get coronavirus. Most people that get this illness, about 80%, as best we know now, it could change in a few weeks, have few to no symptoms. So it's a very mild disease for most people. Where that's not the case is when you're over 65, when you have underlying medical conditions like diabetes, hypertension, or heart disease. Those people don't have a higher risk of acquiring the illness, but if they get it, they have a much higher risk of having serious complications of it. So if you're over 65 or have underlying health conditions, you need to, have a personal conversation with yourself about going back, or a personal conversation with your physician, and then if you go back, you need to realize that your risk is higher than somebody that's less than 65.
Yeah.
There was a great question that just popped into the chat. David, can you speak to what this new normal is going to look like for us? And, do you see this as sort of the permanent new normal? Meaning, last year was the last year that we saw the world as we know it. And what does our world look like?
Right, do buffets and handshakes come back after there's a vaccine?
Exactly.
Uh, I think a lot of things are going to change, and I think uh, the good news, bad news thing is, you know, there's a lot of people trying to get back to normal right now in several states that you mentioned at the beginning, Matthew. And we can see how that works and how it works and how it doesn't work. But I think you will see that things are quite changed. There'll be more social distancing for some time to come. We're talking about probably 2 to 3 years at least, you know. So if restaurants open up, there'll be fewer tables, there'll be bigger spaces. They'll try not to have people waiting, you know, in a waiting area to get in. I think there's a lot of things that'll change, and you can just look at what's going on and see what works and what doesn't work. I mean, there's actually, you know, a great experiment, if you want to look at it that way. That may be not very kind, but there's a great experiment going on right now about what we can and can't do. So while the news is somewhat distressing every night, it's worthwhile looking at it to get an idea of just that, you know, what we can do. And I think we'll find out a lot of information in the next few weeks.
So essentially it's herd immunity, right?
Yeah, but it'll be a long, long time before we have enough people immune that can prevent the disease. Because right now we're trying to prevent people from getting the disease. So if we've, you know, flattened the curve, what we've done is we've made less people getting sick right now and helped our hospitals be prevented from being overrun and being in a surge situation where they have to make some difficult decisions about who to treat and who not to treat. But the consequence of doing that is there's more and more people that haven't been infected or don't have this immunity. And it'll take some time before we get to a point where enough people have been infected or had a vaccine that we'll be able to have what we refer to as herd immunity. So.
And there in Sweden, if I understand correctly, they have not done the same kind of social shutdown, lockdown, safer at home orders, and they still have open businesses and they're still working. You mentioned sort of the great experiment going on. Do you have any perspective on what's happening in Sweden right now?
Not specifically Sweden, but a lot of the places that have tried to successfully do that, and I'm more familiar with Singapore, but they've had very, very aggressive testing of their population, symptomatic, asymptomatic. They've had very, very aggressive contact tracing. If you're sick, someone will come and find out who you've been in contact with. And the average, it seems to be like somewhere for most people between 40 and 60 people. And then someone has to go out and interview 40 to 60 people and test them. So the people that have done this have had very, very aggressive resources based on testing and contact tracing. We don't have that in this country right now. So, and the places that don't have that, it's more of an uncontrolled experiment to see what happens. So I guess the only point I'm trying to make is don't necessarily compare how the Swedes are doing with how we'll do, because you know, the situation is very different in terms of how they're handling the current cases in their country.
And the question just came into the chat bot. When you say herd immunity, do you have a feeling about what percentage of the population would need to get it for us to have herd immunity? And would that be global population, or is that just US population?
Well, ideally global, you know, it's different for different diseases, but for measles and some other things, it's often between 95 and 97%. The good news, like I said, it looks like at least 80% of the people have very mild illness. The bad news is there's some people that are very susceptible to having very severe illness, and that's the elderly. If you look at the people that have had the worst time, it's the people that are over 65, over 70, and people with health conditions. So herd immunity is a long way off. And like we said, at some point in this, we don't even know how long immunity will last or whether immunity is long lasting yet. It's reasonable to assume, but we've been burned in the past assuming too many things.
Yeah. In the past couple of weeks. Well, I want to respect your time and let everybody get back to their quarantined lives. But thank you again. for doing this. We appreciate all of your wisdom for us.
When I think about all this, I think about Charles Darwin because I'm, a science type nerd, but he often explained the evolution of the species. He'd say it's not the most intelligent that survive, it's not the strongest that survive, but it's the species that are most able to adapt to change that survive. And that's kind of where we are. We all need to adapt in some way, and we all have different ways to do that in our workplace, and that's what we need to start thinking about. So.
Right on. Okay, well, thank you, everybody. We appreciate it. And we'll try to do another one of these calls again soon on another impossible to answer question.
Matthew, thank you so much for the road forward. Thank you for this opportunity. Thank you so much, Dr. Davenport, for participating today and helping us all start this conversation. You are brilliant as always. Thank you, Carrie. Great to see you.
Thank you. Thank you so much. Thanks everybody for listening in. Dr. Davenport for your knowledge. Thank you, Matthew, for asking me to be a part of it.
Yeah, we appreciate y'all being here. Everyone read the blog, give us your feedback. Let's do this as a community. We can figure this out. We will adapt.
All right, bye-bye.